Okay, so we begin with the foot rocking. Right?
Foot rocking.
Foot rocking. Thank you, yeah, Professor. Thank you. Okay, ankle rotation. Hold the ankle with one hand and we rotate, right? We check for cracking, tightness, other side, right? Okay. And then we compare that to the other side. See, is one side higher than the other? I think this one is tighter, right?
Yeah.
This one feels like it's moving more easily. So ankle rotations loosen up a little bit. This is called ankle boogie. So it's shaking the ankle. Okay. Do the sides. Go. All right. And then I think the next one is foot boogie. Yeah. So foot boogie is like whole foot. And as you do this, you also assess, right? You're assessing, you're feeling.
That feels good.
It feels good.
Yeah.
Do both sides, ankle. So these are some of the techniques, okay? And then I'll tell you the protocol. You could play with all of these today. We can do toe boogie. Toe boogie. And you can go in and you can come up, right? You can get a little stretch in there. Can you tickle? If it tickles, that means I'm going a little too late. So I have to go more pressure.
Okay.
Okay. All right. Toe rotations. The same thing we did with the ankle, right? You warm up the foot. You're feeling, you're assessing. Right? To the other side. Yeah. Okay. And then the next one is the lung press. So the lung on your sheet, you're going to see is right here in the ball of the foot, right? So you can do a lung press. Right? Other side. With a flat fist. Okay. Okay. Piano keys. I'm playing the piano.
Oh, cool.
Yeah. Piano keys. So loosening up, creating space, right? So we're basically holding gently on top and on the bottom, like the metatarsals, right? And we're just playing with them. So this is piano keys.
This one a little more excess than this one.
Yeah, I'm feeling like, may I share?
Yeah,
Is it okay?
Yeah, that's fine.
So I'm feeling a little bit of like swelling here, or like maybe you're retaining a little bit of fluids on this leg.
Yeah, I do.
Yeah, there's a little bit of like more cushion than I'm feeling.
Yeah, because even my ankle, you could see it.
And then we have the spinal twist. So the spine, where's the spine we said?
At the medial.
Medial, right? So it's like a twisting. A twisting of the spine. Go this way. Spine, yes. And it's funny because here he says applying lotion. It's like now. Okay, and then ringing of the foot. So this is where we go in opposite directions. One goes in, one goes right, one goes left. Right? How's that feel?
Feels good.
That's good.
So far, no pain. I don't feel any pressure.
So these are some of the warm-ups that we're going to do.
So you do all of this?
These are the
An
techniques that I
initial-
want to show you.
Oh, these are different techniques.
These are all different techniques that I want to show you so you have access to them, right? And then you use what you like. Or
Oh,
depending
okay.
on what you think that your patient needs.
Okay.
Okay. Yeah. So this, I would do this here for a while.
Oh,
This feels like it needs it on this side more so. Yeah. Okay.
this is like reducing your flying, right?
Is that how it feels?
Like you're stretching it out.
Yeah, it just feels like just to kind of increase the circulation a little bit. Okay. And then we have dorsal finger circles. So this is like basically we're on the top of the foot now. Who asked about the top of the foot, right? And we're like doing circles going up. And we can also slide down. And get between the toes, right? Going up. And then where do we have stroking? Yeah, so this is this. Begin at the ankle and stroke up, right? We did that. And then it says here, hold solar plexus on the bottom of the feet. So the solar plexus is where kidney 1 is really. So this is the point of like stress relief and empowerment and grounding. So this is a great point to just hold. Sometimes you may feel a release just holding this point. So that is some of the techniques that I wanted to show you. But for zone walking now, like for the specific of that, what I would like for you to practice today, you could play with all of that, okay? But the zone walking, so this is zone 1, zone 2, zone 3, zone 4, zone 5, going all the way down. So zone walking is done with the thumb, and it's like a pressing and releasing, pressing and releasing, pressing and releasing. And it's just, this is it. You see how slow it is?
Can't even feel it.
Yeah, it's very slow. So, and I'm also starting very light, right? So you would do like 3 times each zone. And you
I felt that one.
You felt this one
A
here.
little bit.
Okay, where am I
Yeah.
now? Where am I here? Check. Tender there, I would put more attention here, right? But I'm gonna keep going. I'm making a note in my head, right? As I'm going up, up, up. So Eunice Ingham, she would say, start with the pituitary. The pituitary is right here in the middle of the big toe because the big toe represents the head. The top of each toe represents the brain. So when you have a test, you stand on your tippy toes. So she said, you start here where the pituitary gland, because the pituitary gland is the master gland and it controls a lot of the organs, right? Digestion and the endocrine system, right? Our adrenals. So she said, this is a great point to just go at. And if it's tender, you go more. Okay? So this is the head. So, you're zoning all the way up. I'm just giving you, like, as I'm going, and I remember things I'm telling you. And then you do that 3 times, right? And you can increase the pressure each time and see what your patient says. And then zone 2. Right there, she said.
Exactly.
Where am I? Yeah, adrenal. So we zone all the way up, right? Tender. Now, what am I doing? I'm not like flexing and stretching. No, I'm not doing this because this is very taxing. It's going to get you very tired. You're going to hurt your thumb, right? You keep this bent and you like, this is how you keep it bent and you use pressure. Does this make sense? When you practice, you're gonna see, okay? And then we're gonna be walking around and looking at you. So if you're doing a little bit like too much, we'll let you know so you can give you tricks how to do it better so you don't hurt yourself, right? 3 times. And then zone 3. Right? Zone 3. Zone 3, and you're going and you're assessing and you're feeling and you're making notes, and then also your patient's gonna tell you. It's good. It's good, she said. Zone 3 is great. Awesome. Okay, so you could do this for all 5, 3 times each, if you wanted to. Now, the other thing you would do is you would go across on the diaphragm line, right, which is under the ball of the foot, the waistline, which is in the thinnest part of the foot, and then you have the pelvic line, and you also have the neckline. So there are 4 lines. 1, 2, 3, 4. Okay? You want to go across each one of them. Medial to lateral, lateral to medial, right? See what you're feeling. Okay.
I felt just a little bit on this side.
Yeah, here, the pelvic?
If you went up higher, like in the middle.
The waistline.
Yeah, like that.
Good.